Arbor Health Morton Hospital is a critical access hospital in East Lewis County. Our facility provides an array of care for our patients, including acute care, emergency care, and transitional care rehabilitation, among other specialty services. Our transitional care rehabilitation program, modeled after a Mayo Clinic program, is often called post-acute care. Transitional care is the final portion of care when patients are discharged from a hospital but aren't ready to manage their care at home.
I'm Rick Brooks. On March 15th of last year, I had a pretty serious stroke. It kind of left my whole right side useless. I had to call my daughter, and she brought me here to the emergency room. I was admitted to transitional care, and I wound up living here for 7 weeks.
Some examples of a transitional care patient could be those after joint replacement, stroke, or after a hospital stay from complex injuries or illnesses. These patients might start their care at Arbor Health Morton Hospital, or they could be discharged from large outside hospitals and then admitted into our transitional care program. Our transitional care program enables our community members to recover close to home. With a significantly higher nurse-to-patient ratio than typical nursing homes, our nurse-to-patient ratio of 1 nurse to 4 or 5 patients provides more time for patient care than the typical nursing home, which averages 1 nurse to 10 or 15 patients.
When I first got here, I couldn't do a thing. I couldn't even stand, or I could barely stand up. Oh, the staff was incredible. They did everything for me. The people that got me ready the most was the physical therapy and the occupational therapy. You will never understand how difficult it is to do everything with your left hand when you're right-handed. Everything. Writing letters, everything. Open a bottle of water. I got to use my knees, my legs. I was kind of giving up before, and it was kind of an incentive to know that I'm not going to be a vegetable forever. And the more that I do, the quicker I won't be one. It was really kind of funny because it was 10 days after I got here. I took 3 steps, my first 3 steps. That was kind of an incentive to me, because after we took those first few steps, we were walking all over the place.
In addition, because we are a hospital, we have on-site physicians 24 hours a day, rehabilitation services including physical, occupational, and speech therapies, respiratory therapy, pulmonary therapy, and complex wound care. Depending on your particular illness or injury, you can expect to interact with these Arbor Health team members and more. You will find that our staff, no matter what the department, prides itself in going out of their way to brighten our patients' days. We function as one team with one mission, caring for you. Prior to discharge, we will do everything we can to equip you for success at home. We provide educational materials and assist in setting you up with continued home health or outpatient services as needed. Most importantly, we will set you up with a concrete strategy of how you can be successful on your own.
Throughout my whole time here, I was treated with nothing but velvet gloves. I mean, they treated me so nice and so carefully. They treated me like a king. But they didn't treat me like I was like a disabled vegetable, whatever. Like, they treated me real humane, with respect, and I really appreciated that out of them.
We are here to prepare you for success. At Arbor Health, we care like crazy, and our actions prove it.